Vamos a dar paso a la última de las presentaciones del día. Tenemos ya conectado al señor Alan Woodward. Ahora lo presento, solo quería comentarles a los que están en Zoom que pueden hacer la selección de idioma en el botón que está debajo de la pantalla para que puedan elegir el idioma en el que pueden escuchar la conferencia del señor Alan. Igualmente el señor Alan hará lo propio porque él va a presentar en inglés, pero existe una traductora que va a poder explicarles todo lo que está presentando el señor Alan. ¿De acuerdo? Muchísimas gracias. Bueno, pues como les decía, tenemos la presencia del maestro Alan Woodward. Él es comisionado dentro de la Comisión Nacional de Salud Mental del Gobierno de Australia y nos va a hablar dentro del eje de salud mental y curso de vida acerca de la experiencia en la reforma del sistema de salud mental y la prevención del suicidio en su país. El señor Alan Woodward es consultor en salud mental y prevención del suicidio de la Comisión Australiana que mencionaba, cuenta con una maestría en ciencias sociales y política y es asesor estratégico en calidad e innovación de prevención del suicidio en Australia. También es miembro de la Sociedad Australiana de Evaluación. Bienvenido, señor Woodward. Por favor, tiene la palabra para comenzar su exposición.
Hello and welcome to the Congress. Thank you for this opportunity. It is morning here in Australia and afternoon, I believe, in Mexico. So I bid you good afternoon from my morning. As in the introduction, my name is Alan Woodward and I am a commissioner at the National Mental Health Commission in Australia. I join you today from the Illawarra region, which is a coastal region 100 kilometres south of Sydney in the Australian state of New South Wales. 1/4 of Australia's population lives outside of major cities. So like Mexico, the needs of regional and rural residents can be different to our city counterparts. And I live and work in one of those regions in Australia. I would like to begin my presentation with an acknowledgement of the country that I am on and the traditional custodians of that country, the Aboriginal and Torres Strait Islander peoples, and in my situation, the Dharawal people. In Australia, we give this acknowledgement to the traditional custodians of our lands to show respect to them and their continuing culture, which is the longest culture continuing in human history. I pay my respects, therefore, to their elders, past, present, and emerging. And I thank them for their ongoing contribution to our community, including their insights and wisdom on mental health and well-being. I would also like to acknowledge individuals and families who have a living experience of mental ill health and suicide, and those who are with us, those who have lost loved ones, sadly, to suicide. I extend my thanks to the Mexican Institute for Social Security and the Inter-American Conference on Social Security for inviting the commission that I am part of to speak at today's International Congress. In particular, I would like to acknowledge Master Zoe Robledo, President of the Inter-American Conference on Social Security and General Director of the Mexican Institute of Social Security, Master Alvaro Villarca, Secretary General of the Inter-American Conference on Social Security, Christian Morales of the Pan American Health Organization officials of the Secretariat of Health, and Dr. Daisy Corrales, Director of the Inter-American Center for Social Security Studies. Thank you so much for this opportunity to speak at this important international congress. Mexico is a country of great culture and history. The landscape, the arts, the music, the food, and the history make it a dream to visit and explore. Australians have genuine fondness for Mexico. Mexico is a country we love to visit and a nation of people we enjoy spending time with. Before the COVID pandemic, approximately 85,000 Australians visited Mexico each year, and there are many thousands awaiting the chance to visit again, we hope, in the near future. Australians enjoy visiting Mexico as much as they do welcoming Mexican people to our country. Before the pandemic, nearly 10,000 Mexican citizens visited Australia each year. You may be aware that Australian society is multicultural, reflecting our history of immigration. Our last census data, released in 2016, showed almost 5,000 Mexican-born people living in Australia. This was an increase of nearly 50% on the previous census. So, through these enduring connections to Mexico, we understand the issues Mexico is currently facing, and we appreciate that there are very difficult challenges for the people of Mexico at this time. The World Health Organization has defined mental health as a state of well-being in which the individual realizes his or her own abilities, can cope with the normal stresses of life, can work productively and fruitfully, and is able to make a contribution to his or her community. The Australian National Mental Health Commission adopts this view of mental health and well-being. We use the term a contributing life to describe what being mentally healthy means. It is not just the absence of mental illness or the treatment of mental health conditions. It is the identification of mental health issues early in a person's life, the prevention of their escalation, and recovery from periods of mental ill health to live a fully contributing life. From my own background, having worked for many years with crisis helplines, I know how life circumstances, pressures on family relationships, and financial struggles can affect a person's mental health. Sometimes people despair to the point that they no longer wish to live. Our mental health is related to our suffering. We experience pain. We are not able to function in our daily lives. The social determinants of mental health require attention as much as the biological and psychiatric elements. Personal relationships, safety, housing, meaningful work, social connection, culture and tradition all affect our social and emotional health, our mental health. We recognize that difficult times generate distress and trauma that affects people's mental health and well-being. The COVID-19 pandemic has affected the mental health of millions of people around the world. A recent OECD report, the Organization for Economic Cooperation and Development, found the prevalence of anxiety and depression more than doubled levels observed pre-pandemic in most countries that had available data, most notably in the United Kingdom, the United States, and Mexico. Australia, like Mexico, has seen an increase in the prevalence of mental ill health during the pandemic. The Australian Bureau of Statistics National Study of Mental Health and Wellbeing report, just released this week, provides a summary of data on psychological distress, the use of mental health services, and aspects of well-being between the period of December 2020 and July 2021. During that period, 15% of Australians aged 16 to 85 years, adult Australians, experienced high or very high levels of psychological distress. This was more pronounced in younger years, with 1 in 5, 20% of Australians aged 16 to 34 years experiencing high or very high levels of psychological distress. 15% of Australians aged between 16 and 85 years reported feeling lonely in the previous 4 weeks of the survey. And 16% of households experienced at least one financial stress, such as not being able to pay their bills on time. Those of us working in mental health and suicide prevention want to reach out to people in distress to encourage them to seek help. But we recognise that this distress is not always evident. People do not always disclose their struggles or their inner thoughts and feelings. This can be a big barrier for those of us offering help. People may not come to us without encouragement. They may be reticent to come forward. A characteristic that I think the people of both our countries share is that we are resilient and stoic. A stoic person is someone who can endure pain or hardship without showing their feelings or complaining. As Australians, we recognise this trait as we have historically endured natural disasters such as floods and bushfires, periods of economic downturn and unemployment, and times of uncertainty. Often being stoic is described as putting on a brave face. I understand that you call this el mal tempo buona cari. It can, by its very nature, mean that people often avoid seeking help, even from those around them. The National Mental Health Commission in Australia performs a communications role, promoting the importance of attention to mental health for everyone in our society. One of the messages that the Commission put forward during the height of the COVID-19 restrictions on movement and activity was, it's okay not to be okay. We encouraged people to share their feelings with those around them, family, friends, neighbours, fostering an attitude of looking after each other. And we promoted mental health services that people could use. Government data shows a record number of Australians reached out to mental health services in August this year, when the spread of the virus resulted in our two largest cities, Sydney and Melbourne, going into lockdowns. In 2021, 3.4 million Australians saw a health professional for their mental health. That was 17% of our adult population. 8% of our population saw a psychologist. Approximately 612,000 Australians accessed support services for their mental health via phone or digital technologies, which were made more available during the time of the pandemic restrictions. In Australia, we have 5 leading national teleweb support services. They are Lifeline, Kids Helpline, Beyond Blue, Reach Out, and Headspace. These support services play a vital role in helping all Australians in ways that are accessible at low or no cost and conveniently available at all hours of the day and night. The calls to these support services have been considerably higher in the past year compared to previous years. For example, Lifeline, our leading crisis hotline, during the peak weeks of August this year, experienced an increase in calls by 15% on the same time last year, which also was an increase of 30% on the same time in 2019. The numbers are concerning as an indicator of how many people in Australia are in distress. But they also tell us that more Australians than ever before have recognised the importance of supporting their own mental health by reaching out to one of these services. This underlines the importance of the promotion of mental health services and the value of encouraging people to seek help when there is a need. The Australian government, with the agreement of state and territory governments, has established a mental health and wellbeing pandemic response plan to guide current and future actions to address the mental health impacts of the pandemic. The priorities in this plan are, firstly, to monitor and predict the impacts on the mental health of the whole population, and especially on vulnerable groups within our population. Secondly, to reach people in the communities by making services available, such as through teleweb technologies, to provide more funding for existing local community services, and to equip schools and workplaces to promote the pathways for support on mental health. Thirdly, the planning provides clear pathways of care so that there are better linkages between services and the use of multidisciplinary teams to coordinate various aspects of care and treatment for people experiencing mental health conditions. The pandemic has highlighted many common, but also many under-recognised mental health issues that the Australian people can experience. In some ways, the pandemic has magnified stresses that were already present in our mental health services and systems. The past 2 years with the pandemic and the years prior when Australia experienced severe natural disasters such as drought, fires and floods have underscored the urgent need to change and improve the ways we address mental health in Australia. Over the past 3 years, Australia has been on a significant journey of in-depth review, focusing on how we provide mental health support to Australians. We are still on this journey, but we are learning how to do things differently along the way. The National Mental Health Commission's role is to provide strategic policy advice to government and to be a catalyst for change. The Commission has been involved in all aspects of the review and reform journey over the last 3 years. Since 2018, we have been consulting with mental health experts, including psychiatrists and psychologists and general practitioners in our primary health care. We have asked them how the mental health system needs to be improved to meet the mental health needs of all Australians. We have also been consulting and listening to people who have experienced services and supports from our system. And they have told us of gaps and problems that need to be addressed. It was important when embarking on this journey that all stakeholders were involved, and we explained to them the intentions and approach of the Australian government to investigate, identify and respond to the needs that we found. The Commission committed to ensuring that each step we considered would address how every Australian can live a fully contributing life, a life in which Australians experience and enjoy their strongest possible mental health and well-being. A contributing life in which a person is thriving, not just surviving, has effective support, care and treatment, feels connected to family, friends, culture and community, has meaningful things to do and look forward to, and feels safe, stable and secure. The first step for the Australian government was to understand the extent and cost of mental ill health in Australia to inform the necessary policy decision-making. So in November 2018, the Federal Treasurer requested the Productivity Commission in Australia to investigate the intersections between mental health and well-being, economic participation, productivity, and economic growth. The Productivity Commission's inquiry examined the extent of mental health on people's ability to participate in and prosper in the community and workplace. It examined the cost and effects of mental ill health on our economy and productivity. It looked into government's responses across Australia and those of employers, professional and community groups, education sectors, employment, social services, housing and justice, to see how all could contribute to improving the mental health for people of all ages and cultural backgrounds. The inquiry was also asked to calculate the cost of mental ill health in Australia. The final report was released publicly in November 2020. It reported that the cost of mental ill health to the Australian economy was over $220 billion a year. The report identified the need to focus on well-being and recovery from mental ill health, the importance of prevention and early intervention when mental health issues arise, the need for changes in the whole system, and the need to include services beyond health-based services that could contribute to mental health. The report emphasised the need to ask people about their mental health and listen to what they needed. While this inquiry was underway, the Commonwealth Minister for Health asked the National Mental Health Commission to develop a 10-year plan for mental health and suicide prevention in Australia. This 10-year plan identifies what the experiences would be for every Australian if the system successfully looked after and responded to their mental health and well-being needs. Being a 10-year vision, this project was titled Vision 2030. To develop Vision 2030, the Commission had to understand the changes needed to our system so it could be accessible to anyone, more easily navigated, and how it could deliver outcomes for mental well-being. The development of Vision 2030 began with a connections tour, an activity that saw the Commission connect with over 3,000 people from all parts of Australia to listen to their experiences of our current mental health system and their needs and expectations for improvement. What we heard was stark and confronting. As such, our Vision 2030 blueprint reflects what we have heard from these Australians with a living experience of mental ill health and from those who care and love them. The Vision 2030 blueprint identifies 4 important elements of the system. Firstly, and for Australia, where we have 3 levels of government, national, state, and local. Firstly, to be effective, all levels of government need to be coordinated and consistent in their approach. The phrase we used to reflect this was for a reform called whole of government's approach to mental health and well-being. Secondly, the system needs a whole of community approach to support a person's mental health and well-being, to value the role that everyone in the community can play in supporting a person and identifying where early interventions may be warranted in a person's mental health. Thirdly, to recognise the importance of a person's whole of life. That is, that mental health and well-being needs may be different at each stage through a person's life. And fourthly, that a person-centred approach to prioritise the person's wishes and the issues that are of most importance to them in the preparation of the care response by clinicians and health professionals. By the time the Productivity Commission's final report was ready, the National Mental Health Commission was able to align the work of Vision 2030. So the two significant pieces of national policy work, informed government decision-making and the implementation of improvements. The Vision 2030 blueprint recommends the system design needs to recognise the mental health and well-being needs of every person can be responded to in all situations wherever they live, across cities, but also our regional, rural and remote communities. The implementation of balanced community-based care within rural and remote locations will need to consider different ways to provide reliable, regular, local services and to build relationships and trust with those communities. I believe that this is an issue you will be able to relate to in Mexico, where your regional and rural communities are strong, but that may require different approaches to service provision and address different needs than for those people in major cities. The Australian Vision 2030 blueprint also identifies a need for an approach that accommodates a greater understanding of health and its connections to social, emotional, spiritual, cultural, physical, nutritional, economic, and other factors affecting the well-being of individuals and communities. Social and emotional well-being recognises that mental health is conceptualised differently across cultural groups, and that these meanings and knowledge systems are important in understanding and responding to mental health for these communities. As I mentioned earlier, Australia is a multicultural society. We also recognise the unique culture of our Aboriginal and Torres Strait Islander peoples. Our approach to mental health and well-being must reflect the diversity of cultural outlooks and experiences in our country. We also acknowledge that experiences of mental ill health and suicide are linked to experiences of disadvantage, social exclusion, and marginalisation. These might be regarded as social determinants of health, some of which are societal, some of which are environmental, including remoteness or the built environment, some of which are socio-economic, and some of which relate to health and biological factors that may underpin a person's life, such as historic experiences of childhood disadvantage or trauma. Vision 2030 determines that a cross-portfolio approach is needed to address the Australian population's mental health and well-being. So not just the health portfolio, but portfolios such as employment, housing, social services also need to address the social determinants of mental health and well-being. For Australia's Indigenous communities in particular, the embedding of social and emotional well-being understandings and their link to spiritual and cultural approaches are critical to delivering effective programs for supporting mental wellness and recovery. It is essential that Australia has a mental health and suicide prevention system that emphasises wellness, promotes good health, and addresses issues that contribute to poor mental health. to maximize the positive and protective factors for everyone. Supporting individuals in developing their coping capabilities, problem-solving skills, and resilience can also promote more positive life experiences and a capacity to manage the challenges as they arise. In other words, a proactive approach to the general well-being of all Australians is key to reducing mental ill health and preventing suicide. Vision 2030 has prompted a number of key projects designed to expand on existing knowledge and research and ultimately strengthen Australia's mental health and suicide prevention systems. One project is the preparation of National Suicide Prevention Advice. In April 2021, the National Suicide Prevention Advisor, who also is the Commission's Chief Executive Officer, Ms. Christine Morgan, released the National Suicide Prevention Final Advice. This advice to government was informed by an expert advisory task force and drew on a tremendous amount of research and consultations and engagement with many people who had living experience of various aspects of suicide and suicidal behaviour. The advice was prepared following visits to communities, towns and cities to hear the real experiences of people who have been impacted by suicide. The advice highlights the importance of a national approach to suicide prevention that spans all ages and acknowledges that challenges can commence early in a person's life that may then be exacerbated by stresses and other events across their lifespan and may lead the person towards suicidal thoughts and behaviours. If the health, social, cultural and equity issues contributing to suicide are well understood and the touch points along people's journeys are identified so resources can be provided for their support, there are many opportunities to assist people before they reach a crisis point. The advice on national suicide prevention includes 8 recommendations. They are, firstly, for there to be leadership and governance for a whole of government approach. Secondly, that suicide prevention strategy, programs and services draws on the knowledge of those with living experience so that services and responses are relevant and appropriate to need. Thirdly, to improve the collection and reporting of data and evidence to drive better outcomes from suicide prevention strategies and programs. Fourthly, to build a workforce capability at all levels, including the communities, for suicide prevention. Fifthly, to specifically seek to respond earlier when people are experiencing high distress as a result of a life circumstance. Sixthly, to connect people to compassionate services and supports in recognition that suicidal thoughts reflect pain and suffering. 7, to target groups that are disproportionately affected by suicide. In Australia, that includes males Aboriginal and Torres Strait Islander peoples, peoples who identify as LGBTQI in background, rural and remote residents. And lastly, to recommend delivering policy responses that improve people's security and safety. Each of the recommendations is critical to achieve system-wide suicide prevention reform and to save more lives. A National Suicide Prevention Office is now being established within the National Mental Health Commission to lead and monitor reforms in suicide prevention. A central role of the Commission is to provide evidence and advice to the Australian government on ways to continuously improve Australia's mental health and suicide prevention system. Data is essential to the performance of this role. Without knowing and understanding data, the Commission cannot provide evidence and advice to government, and governments, therefore, cannot adopt and implement change. To illustrate